Okay, well, welcome everybody. We are at 12 o'clock. We've got more people kind of trickling in. So we're going to do some intros and some welcomes, and then we'll hand it off to Jonathan and he'll get us going on today's Tuesday talk. So first of all, thank you for being here. We appreciate you taking your time on your Tuesday to come spend with us, whether this is the first one that you've attended or if you've watched a couple or one of the Tuesday talks we've done prior. We are glad that you're here. This is our fourth one. If you missed the other ones, the first three topics we covered were, the first one was just an overview of back pain. The second one was about spinal cord stimulation. And then the last one that we just did in June was about arthritis and different types of arthritis. And those are all available on our website to rewatch if any of those are interesting to you. But today we are going to be covering neuropathic pain, and Jonathan's going to take us into a deep dive of what exactly it is and what some options are to treat that. But before we get going, a little housekeeping. You will see on your screen on the right-hand side, and maybe on the bottom, a tab called Q&A. If you have questions during the webinar, feel free to put them in there, and then we will review all of the questions at the end of the webinar. We just ask not to put super specific personal information there just for HIPAA reasons. Try to keep it a little bit more generic, or just don't use any personal information about you that would identify you, just for your own protection. Other than that, we're going to do a little intros of all the providers, let them introduce themselves. I think Dr. Velling will be jumping on here in just a second. So there he is. So Michelle, I'm actually going to start with you, if that's okay. I don't know if you're able to pop on. Okay. Michelle, go ahead and take it away, and then we'll have Dr. Velling introduce himself, and then hand it over to Jonathan.
All right, good afternoon, everyone. My name is Michelle Scott. I'm one of the other physician assistants here at the practice. It's really great to see everybody on here. Jonathan has an excellent talk about neuropathy today, and I hope we all learn lots.
Yeah, welcome, and thank you for joining us, everyone. I'm Dr. Belling, the medical director of the practice here, and so I think Jonathan has a lot of good information to present today. Our other physician, Dr. Kinder, was not able to be here with us today, but we will be happy to answer any questions that come up during or after the talk that Jonathan is giving. So I'll let Jonathan take it away from here.
All right, good afternoon, everybody. I hope everyone had a fun and safe July 4th weekend. So we're right back at it. So today we're going to be talking about neuropathic pain. And in case y'all haven't met me yet, I'm Jonathan. I'm one of the physician assistants. I work alongside with Michelle, and we see a lot of the patients here. And we also help out with some procedures as well. But today we're going to be talking about neuropathic pain. Now, neuropathic pain is a pretty deep topic. I'm not going to lie. It's a pretty intensive topic, but I wanted to try to make it approachable to everybody today. And I welcome any kind of questions or any clarifications you guys might want. So like Maddie was saying earlier, please feel free to use the Q&A tab. So let's get started. So today we're going to talk about what neuropathic pain is. It can mean a lot of different things. And we're going to talk about all the different types of, not all the different types of causes, but most of the main causes, as well as how we diagnose it. And then we're going to talk about some treatment options, especially treatment options that we can help with here, especially at Genesis. So what is neuropathic pain and its symptoms? Well, neuropathy at its core is just a disturbance of your nerves. So your nerve is supposed to function normally one way, but if it deviates in any way, it's called neuropathy, and oftentimes it can present in pain. So it can present in different types of nerves. Your peripheral nerves, like going to your arms, fingers, legs, feet. It can even occur from your spinal cord, and that sometimes can lead towards pain going down your legs or going down your arms as well. And you can even have it in your brain, and sometimes can cause things like stroke. But with neuropathic pain, it's not just pain we're talking about. yes, you're going to often hear complaints of shooting pain, burning pain, stabbing pain, shock like electrical type of pains. But then neuropathic pain is also considered pins and needles sensation, maybe some numbness, maybe some tingling, even weakness in your arm, or if you notice one arm or one leg is hotter than the other, temperature changes also count as neuropathic pain. And like I said, it's not just pain like something hurts all the time. It can be any of these symptoms, and we still classify it as that. Every now and then you'll have patients complain of muscle spasms and tightness associated with some of this pain episodes. And sometimes that's just from your nerves misfiring essentially, and that can cause a lot of these issues as well. And that might not necessarily be considered pain, but we still count as part of the pain umbrella. So there's different types of neuropathy, and this is just a very, very small list of some of the different types. These are probably the most common types that we see here, and also most common types we see in America. So for example, we have cervical, thoracic, and lumbar radiculopathy. Lumbar radiculopathy, also known as sciatica, for those who have maybe heard that term before. That's basically from, you have nerve pain from basically your spinal cord. But then, like I mentioned earlier, we have peripheral neuropathy, we have diabetic neuropathy, we have carpal tunnel syndrome. That's actually considered neuropathic pain. Myalgia paresthetica, that basically is pain on your thighs, on the lateral aspects. Or if you had an amputation, you can have phantom limb pain. That's also neuropathic pain. Postherpetic neuralgia, that's pain if you've had like a shingles episode and are in extreme pain from that. You can have trigeminal neuralgia, which is pain on the side of your face. That can be from that as well. And you also just can have general polyneuropathy, and then something called complex regional pain syndrome. That's also considered a type of neuropathy, and that's a very painful syndrome to have. And there's a lot of different diagnostic criteria for that. But like I said, I just wanted to kind of introduce the topics to everybody. So this isn't an exhaustive list, but if you see something here that maybe you see, oh yeah, I've had carpal tunnel syndrome, so this could even apply to you. And I started talking a little bit about it, but there's multiple causes of neuropathic pain. And at the core of all of them, it's due to a lesion or a disease of the nerve that's causing the nerve to dysfunction and misfire, essentially. In your central nervous system, you can have spinal cord injury, and that can cause cervical, thoracic, or lumbar radiculopathy, like I mentioned earlier. That's something that we treat here very predominantly. You can have a stroke that's causing neuropathic pain. You can even have multiple sclerosis or Parkinson's disease, and those can also contribute towards neuropathic pain. But then for the peripheral nervous system, so these are all your nerves that go to like your limbs and your arms, hands, legs, and feet. So there's a lot of different causes for these, but some of the most common causes are spinal nerve compression or inflammation. Maybe you have a pinched nerve somewhere, or trauma, surgery. A car accident will definitely do that. Diabetes is one of the most common ones that we see causing diabetic neuropathy. Alcoholism can sometimes damage the nerves as well. Facial nerve issues, like I said, the trigeminal neuralgia on your cheek I mentioned earlier. HIV, AIDS, shingles, those all can contribute towards neuropathic pain and follow specific patterns. And whenever you have like a shingles attack, that could be one of the presenting issues, that you have neuropathic pain related to it. Complex regional pain syndrome, CRPS for short, is something that can affect the limbs and then even spread throughout your systemic body. And also for patients who are on chemotherapy regimens, sometimes the drugs that are used can cause neuropathic pain. And the same thing with tumor and radiation therapy. And like I mentioned before, amputation with phantom leg syndrome or a phantom arm syndrome, that can happen too, okay? So it's a lot of different causes, and it's really hard to determine, okay, what's the cause of your pain unless you actually get it looked at. So one of the first things that we want to do is have you come see one of us, one of the providers. We can basically do diagnostic tests. We can do a history, we can do a physical exam, and sometimes that can help us kind of give us a good idea what we're looking at here. Every now and then, you might, if you see like your primary care provider, they might order some blood tests. These include a CBC to check for your blood counts, your platelet counts. A BNP or CMP will help check for electrolytes. A hemoglobin A1C will help check for diabetes. And then we might have some providers run some vitamin tests. And every now and then a vitamin deficiency can also be the cause of these neuropathic pain episodes. Something you might see that we do here a lot is that we order imaging exams. These include CTs, MRIs, and even X-rays. The CTs and MRIs are going to be really good at showing the soft tissues, as well as showing if you have any kind of herniated discs or like pinched or compressed nerves, or even worst case scenario, a tumor. But if it shows us that, we can at least point you in the right direction or help treat some of your pain. And then if it really gets to a point where we're not really quite sure what's going on, or if we want to get more in-depth information, we can order what's called a nerve function test, and basically an electromyogram. So that's what EMG stands for. It's if you look at the picture on the left here, this kind of gives you a decent idea of what an EMG can look like. Basically, you are getting shocked on a couple of spots, but that helps us determine, okay, which nerve is misfiring, which nerve is causing the pain, or what nerve is not functioning as it's supposed to. And you can do it in both the arms and the legs. And that can give us a lot of diagnostic information that way as well. But those are all the diagnostic, not all of them, but these are the main diagnostic imaging exams, blood tests, and nerve study tests that you might see us commonly order, because like I showed you before, there's plenty of causes, there's plenty of different types of neuropathy, and it's really our job to help you figure out and pinpoint down which one is actually affecting what your pain is. And every now and then you actually might have a patient who shows up with two different types of neuropathic pain. Like maybe, for example, if you had cervical radiculopathy, but hey, you also had a component of carpal tunnel syndrome. That actually happens from time to time, and these diagnostic tests will actually help us. And the biggest thing is just coming in to see us for a physical, because that's where we're going to start getting that gut feeling, okay, is it this or that, or what do I need to get to kind of help me figure out what's going on here? So once we kind of get through the diagnostics of it, there's a lot of treatment options. Ultimately, the overlying umbrella is to treat the underlying cause. You have different types of treatments for all these different types of neuropathy, and each one targets different nerves. Each one targets a different type of pain even. So just to kind of go over the list a little bit, we have our cervical, thoracic, and lumbar radiculopathy. These are procedures we do here. We do epidural steroid injections. And if it gets to the point where the steroids aren't working or they're starting to wear off a little bit more, we can even look at spinal cord stimulation. And we've had a great talk with Dr. Kinder about that a couple months ago, I think 2 months ago. And we took a deep dive into that. So if you like, refer back to that webinar and you'll be able to find out a lot more about spinal cord stimulation and how I might be able to help you with that. But in addition to all those options, we have to go through, again, all the diagnostics to make sure we're kind of covering the right thing here. So then the next most common thing we see in medical world is diabetic neuropathy. So we want you to be able to control your diabetes better, because it's not just going to help with the neuropathic pain, it's also going to help with other issues, such as maybe you are drinking a lot of water, or you're going to the bathroom a lot, or your blood sugars are so high that maybe you get so high and you get so low, and that can affect your mood. So controlling your diabetes better is going to be one of the key things to helping treat diabetic neuropathy. But there are some medications that can help with that, like gabapentin, Lyrica, duloxetine, amitriptyline, capsaicin. And I actually wrote a blog post on this recently. So if you like, you can go ahead and check it out on our website. And that's where I go much more in depth about diabetic neuropathy and talk about the different types of treatment, as well as go a little bit more in depth about what the pathophysiology about it. But moving on, we also have carpal tunnel syndrome. We can actually do a steroid injection for that. And that might sometimes be able to help loosen up a lot of that inflammation that's being caused by the nerve. Same thing with myalgia parasitica. That's that thigh pain you might feel on the sides. And we do lateral femoral cutaneous nerve block for that, where we go in and basically block the nerve and numb it. And that can sometimes give you some good pain relief as well. For phantom limb pain, that's if you had an amputation and you still feel some of that neuropathic pain. Spinal cord stimulation is a great option for that. Post-herpetic neuralgia, that's for those shingles attacks that you still have pain afterwards. These are procedures we can do here with intercostal nerve blocks. And these are nerve blocks into the nerves that kind of go around the ribs. And we can also do epidural steroid injections into the epidural space, and it kind of helps cover a lot of the nerve inflammation from more of the center aspect. So then if you also have trigeminal neuralgia, we can also do like a Gasserian ganglion block, basically on your cheek. The trigeminal neuralgia, the pain comes from that specific ganglion, so we can go and block it, and that might give you some pain relief as well. Polyneuropathy, like I mentioned, those medications earlier, spinal cord stimulation has actually made great strides in the past several decades, and it's starting to become more and more studied, and a lot of studies are beginning to show that it's more effective at controlling pain than actual pain medicines are. So that is a consideration that we can help you out with as well. And then you have complex regional pain syndrome. This is a really atypical type of pain. Usually there's some major accident associated with it, and that can cause you to have nerve pain shooting pretty much everywhere. But it often starts with one or two of your limbs and then can even spread to the other limbs. So spinal cord stimulation has been shown to help with that, but also ketamine infusions are something that may be beneficial for those patients. So one of the main things that we treat here is radiculopathy. So that's a cervical, thoracic, and lumbar radiculopathy, where it starts from the neck and goes down your arms, maybe starts in your mid back, goes around your ribs, or it starts in your low back and it goes down your legs. So I just wanted to take a quick minute to kind of talk a little bit more in depth about these treatment options, especially since they're treatment options that we offer here. With epidural steroid injections, we are basically putting an anti-inflammatory steroid medication into the area where you have really bad nerve inflammation. There's multiple approaches to do this. So transforaminal approach, if we're looking at the image here, let me see if I can get my laser pointer here. Nice. So my transforaminal approach, that's more from the sides here. And those can target specific nerve roots. If your MRI showed me that you have a compression of the L4 nerve root and your physical exam correlates with that, this might be a better approach for you. I often call this the sniper approach because we're going specifically for the nerve roots. Then another approach is the interlaminar approach. This is going in between your actual vertebrae bones. And with this, you get a little bit more of a bigger spread. So you might get medication spread, not just here, but up a couple levels as well as side to side to some of the nerve roots. So that might cover a little bit more area. And then you also have the caudal approach, which is going basically through your tailbone. There's a little hiatal hernia here, not hernia, hiatal pass where you can go through here. And that's actually a perfect spot for the needle to go through. And I call this the true shotgun approach, in that we put a lot of the steroid medication, it travels all the way through here where you have plenty of nerve roots, as well as sometimes going up into your lumbar spine. And all this is done to help alleviate nerve inflammation. But like I mentioned before, let's just say you've done steroid injections and over time you notice that they're not lasting as long, or maybe you get like maybe a couple days of relief and then it kind of just goes back to normal. Well, one of the things that can really help you out is the spinal cord stimulation that I mentioned earlier. It's also called a dorsal column stimulator or spinal neuromodulation. And it allows the SCS, which is short for spinal cord stimulator. It allows you to send electrical impulses, no drugs, to the spinal cord, and essentially it helps block pain signals from wherever your pain is coming from reaching your brain. So what we do here in our clinic is that we actually give you a 7-day trial. This is one of the few implantable devices where you actually get to try it out for a week before you decide to commit to it and get a permanent implant. With the 7-day trial, we basically give you the whole keys to the Cadillac. We let you try out different types of programs, see if it works for you. And if it works and helps control your nerve pain, then we refer you to one of the surgeons we work with for a permanent implant. Now, it is important to note that this generally only helps nerve pain and not so much arthritic pain, which is another topic that we covered in another webinar. But if you have mainly nerve pain, and let's just say you have like lumbar radiculopathy, this could be a good treatment option for you. One of the other reasons that this could be helpful is if you've had like a back surgery and you still have nerve pain going to anywhere pretty much not in your back. So if you're going to your arms or going to your legs, and it's all stemming from an area where you had a previous surgery at, that this can also help with that. And like I mentioned, Dr. Kinder gave us a great webinar on this a couple months ago. So if you'd like, go ahead and review that. We have a link to it on our website. And let's see here. Just to kind of review, we talked about what neuropathic pain is, some of the causes, some of the symptoms, some of the diagnostics, and some of the treatments. And like I said, there's a lot of different types of neuropathic pain. I think I only listed about a quarter of the list. There's quite a few more. So this isn't all inclusive, but at least it gives everyone a good broad overview of some of the main topics that we see and a lot of the main issues that we see here in our clinic as well. And hopefully, moral of the story is there's a lot of different types of pain that could be occurring here, a lot of different causes, and you just have to get it checked out, and we'll help you kind of guide along the way to figure out what could be the best approach for you. And with that, I guess we'll be taking questions.
Yeah, thank you so much, Jonathan. That was super informative. To anybody who either has neuropathic pain currently or knows someone that has it, I think it can be sometimes a daunting topic, and it can be really painful. So it's helpful to know that there are solutions, and that really, it's important to identify exactly which type you're dealing with. So one of the questions we got is about a lab test specifically around testosterone, and if low testosterone levels, specifically in men, can contribute to neuropathic pain, or if that's something to be, just aware of as you're getting older, as a male, if that can be something to keep an eye on.
So with testosterone, that could be one of the blood tests that your primary care decides to run. If you're having more neuropathic pain, like you're having some numbness or issues with urinating, or if you're having issues going down your legs, then that might be something that we would want to look further into. It could be something like that's called caudate equina syndrome, and that's where you have certain nerves that are really pressed upon down there, and that could actually be a surgical emergency at that point. But that's something that testosterone level, yes, is certainly something we can look at. They might even order like a prostate level, and I think it could be quite a few things. So it's a little multifaceted, I believe. I'm not sure if Dr. Velling would have anything to add to that.
I would say that just in general, a low testosterone level by itself is usually not going to be a reason to cause neuropathy or nerve pain, but it's usually if you have some type of nerve pain or neuropathy, there is a low likelihood that that your testosterone level may be affected. But that's usually not the first thing that we're going to be looking at. So it's a good question, but if you do have a low testosterone level and you have neuropathy, they're usually not. There's very rarely a direct correlation.
Okay, another question is, are any type of neuropathy in general, reversible or curable? Or once you have it, is it kind of just a matter of handling the pain? Kind of give us the scope of that.
Okay, well, I can address that. It's really dependent on the type of neuropathy that you have and how long you've had it. And so the question is it curable or is it reversible? Oftentimes, if your nerve pain comes from, something acute, then it can be addressed. If it's from a herniated disc that's pressing on a nerve, that can be addressed and oftentimes fixed either with some type of injectable therapy or surgery. If it is a peripheral neuropathy, like diabetic neuropathy, that is very rarely curable, but it can be controlled. The symptoms can be controlled. So it's a very broad topic. So really, it's very dependent on what type of nerve problem you have. Sometimes it can be treated and fixed, and in other cases, there is not going to be a cure, but it can be controlled.
Okay, Jonathan, did you want to add anything, or that covered that?
Dr. Belling pretty much answered it exactly the way I probably would have. The only other thing that I'd like to kind of remind patients of is that in medicine, there's really no true cure for really anything. A lot of times what we do here is to help manage the symptoms. And like Dr. Belling was mentioning, a lot of these things are very controllable. We can help get all these symptoms under control so that you can return to that quality of life that you want and not have to just live with it. So that's all I would really add.
Yeah. Okay. In the case of radiculopathy, as you were talking about the different ways to approach a epidural steroid injection, can you explain the potential longevity of those procedures in general? I know it's going to vary, but in general, what's the longevity of an ESI?
So for any kind of steroid injection, we hope to get prolonged relief. So we want it to last as long as it possibly can for you. However, though, everyone's different. Everyone's nerve inflammation is at different levels. So sometimes we like to see it hopefully last at least 3 or 4 months at a time. But like I said, everyone's a little different. Some people might have it last 3 or 4 months and they come back for a repeat injection. Some people, I've literally seen it go as far as like 1.5 years to 2 or 3 years even before they need a repeat. So it really depends on the pathology that's going on and specifically what's really happening under the skin there.
Okay. If anybody else has any more questions, feel free to throw those into the Q&A section. I haven't seen any more pop up lately, so I'm just going to have you go one slide forward, Jonathan. And just a quick reminder that the next Tuesday talk we're doing is in a month from today on August 2nd, and Dr. Kinder will be leading this one, and we'll be talking more about regenerative medicine, what it is and who it can help and what types of pains it can help. This is something that we offer here at Genesis, so we're going to be focusing on the options we offer here and how we came to being to do these. But Dr. Kinder is going to do a deep dive into that. And we hope that you'll join us, or if you know anyone that's, even heard of regenerative medicine, heard of stem cell therapy, is curious about, is it is it worth looking into? How could it potentially help me? You know, we're going to be covering a lot of general and also some specifics about who this can be helpful for. I think we're good on questions. I'm not seeing any more pop in. So let's just go ahead and jump to the last slide and just an overview of how to contact us. If you would like to make an appointment or just have any more questions, you can give us a call or an email. Our website is listed there at the bottom, and we'd be happy to just chat with you and see if there's any way, you know, maybe something we offer here could help, or just answer some questions for you. And you may, you know, you may end up seeing Jonathan for your new patient visit or for follow-up, and he can kind of run you through these questions specifically for your what pain you're going through. So with that, I'm going to let you just close this out here, Jonathan. And thank you everyone for coming. If there's anything else you want to say, Jonathan, feel free.
Well, I just want to thank everyone for spending your afternoon with us, and hopefully, I know it was a lot that we went over. It can be a little daunting, but that's what we're here for. We're here to help guide you on the path to getting back to your life. So feel free, just give us a call if you have any questions, or if you'd like to see one of us, we'll be happy to help you out. And again, thank you guys for coming.
Thank you.
Thank you, everyone, for joining us today, and thank you, Jonathan, for a good informative talk. And hope to see you next month.
All righty
Thank you.
then. All right, everyone, have a great day.
Have a good day.
Yeah.